So in truly great storytelling, there is often a recognizable character arc. One of the most famous of these is the redemption arc, where there has been a character who has been selfish, unethical, if not downright villainous, but where they make amends for their wrongdoings. And often the end of the story has a great reveal where there's a heroic act of sacrifice on behalf of this villain as they transform into becoming a hero. But these are very tricky stories to carry off. But when they're done well, we as the audience are usually mesmerized. These are some of our favorite stories. And today I'm going to tell you a story of what I believe is one of the greatest scientific redemption arcs in history, that of the virus. So my name is Dr. Nicole Paulk, and I am the CEO and founder of Siren Biotechnology. Let our story begin. So every great redemption story starts with a great villain. You can think of some of the characters we love to hate, the greats. So characters like Maleficent, right? The embodiment of darkness, who is capable of casting a spell of eternal sleep, to Killmonger, right? One of the revolutionaries whose methods blurred the lines between villain and a hero. Even someone like Gru, right? This bumbling mastermind who, despite his best efforts, couldn't resist the infectious pull of friends and family. But what unites all of these characters? It's the redemption arc, when we realized that their darkness was not absolute and that they could make amends for their villainous past as they transformed into becoming the hero of the story. And in science, we're experiencing one of these redemption arcs right now. This is the redemption arc of the virus, and that's the story that we're going to talk about today. So viruses have long been cast as kind of the penultimate antagonist in our pop culture and in our lived human experience, as the thing that is always evil, right? So whether we're talking about smallpox or Ebola, these little invisible agents of fury have kind of captured our imagination in things like movies, Outbreak, 28 Days Later, Contagion, and on and on. But for today's story, like this title suggests, we're going to start where we all kind of first met the concept of a virus, which was through fear. Right? This is quite literally a history written in blood. If we start off with kind of the grand pumbaa of death, unfortunately we're talking about smallpox. Right? This is a virus that swept through entire civilizations and quite nearly wiped humanity off the map with 300 million human deaths. Or say, take the 1918 flu that ravaged a world that was already weary from wars at the time with 100 million deaths. Even something like HIV has killed more people than all wars combined. And yet, right, this is not reflected in our priorities or in our federal budgets. Just last year alone, the United States spent $820 billion on defense, but only $12 billion on health, right, to fight things like viral infectious diseases, right? 820 billion versus 12 billion, right? That doesn't quite match up with what I've just shown you. So if we take a deeper look at some of these villains and perhaps start with smallpox, right? This little invisible invader quite literally swept the globe, infected folks, and spread like wildfire, like you're seeing here. And in this next slide, we've got some images that are, quite frankly, a little bit hard to look at, but these are smallpox patients. And these images serve as a stark reminder of just how cruel Mother Nature can be. And the penultimate narrator of our story, Mother Nature, then did it again. Right? So with the 1918 flu, the world thought it was about to experience just another seasonal flu outbreak like we all experience every year. But what ended up transpiring was anything but. This particular strain of flu swept the globe and killed an estimated 100 million people. And what you're seeing here is a really now famous image of Camp Funston in Kansas, where there was an emergency makeshift hospital that was set up to try to desperately treat the dying, in many cases unsuccessfully. And this particular strain of flu, H1N1, like I said, swept the globe and left its patients with really uncontrollable flus and fevers and all of these types of things. And what is scary about flu, particularly right now, right, this strain of flu that swept the globe, killed 100 million people, was the H1N1 strain. And the strain of flu that's currently circulating amongst our chicken population right now, that makes it so that none of you can get eggs in the grocery store right now, is the H5N1 strain. And for virologists like me, that is the strain that makes us very scared, because H1N1 infected 1 in every 3 people on the planet. H5N1 kills 1 in every 2 people that it infects. So a really terrifying difference. No story of viral fear could ever possibly be complete without talking about Ebola. This is literally the stuff of nightmares. This little apocalyptic nightmare has captured our imagination with fear, and rightfully so, since it was first discovered. Patients that have Ebola have uncontrollable fevers, internal bleeding, and organ failure, and the worst of these outbreaks has seen mortality rates as high as 90%. It is the stuff of nightmares. So this is normally how we think about needing to respond to viruses. They are something to be sterilized against. They are something to be destroyed. All of our advancements are about finding ways to contain them and keep them out. And it's our fear-based relationship that we have with viruses. But in labs all across the world, some scientists like me have been asking a rather radical question, which is, are we not really seeing the full picture here? What if not all viruses are our enemies? What if we could leverage the fact that they're very good at sneaking past our defenses and getting inside of our cells to use them as a way to deliver genetic medicines, to transform them from villain into hero, from something that spreads disease into something that could be used to treat and cure disease? So to kind of enter this world, we need to understand what a virus actually is. And at its core, it's very simple. It is just genetic material wrapped in a protein shell. Nothing more, nothing less. It has no conscience. It's just pure efficiency. It has one and only one job: to infiltrate the host, get into your cells, take over your cellular machinery, and replicate itself. It is pure, simplistic efficiency. But we can leverage this and allow these viruses to now, we can basically remove the genes that cause these viruses to make you sick and replace them with anything we'd like, any type of genetic medicine, to allow these to now become basically nature's perfect delivery system. And all around the world, scientists like me started having this kind of feeling we couldn't shake, this feeling that we had seen this before.
Déjà vu.
So again, we kept having this feeling that we had seen this before, and that we knew that viruses were very good at getting inside of us, which is something we're trying to have happen with all of the medicines that we take, and that we could engineer these to go wherever we'd like in the body and deliver these genetic medicines. And if that concept of using a virus as a medicine sounds revolutionary, it is. But it's not science fiction, and it's not the Matrix. Right? This is viral gene therapy. And these viruses can now become our newest partner or our newest ally in treating diseases. Because again, we can leverage the fact that they're already very good at getting inside of us, and we can now basically program them to carry different things like genetic medicines to anywhere we'd like in the body in a very precision and controlled manner. So how do viral engineers like me actually engineer these viruses to be this perfect delivery system, to go anywhere we'd like in the body? So first, I'm going to show you a video that's kind of an inside the cell view of what's happening inside a cell when it receives a viral gene therapy. So these viruses are like a package, and they need an address label so that they know where they need to go in the body to deliver that genetic medicine. And viruses have evolved to already be very, very good at getting inside of your cells and delivering a genetic payload. They do this already, but we can remove all of the genes that the virus normally has and replace it with whatever we'd like, so that way the virus can still enter your cells, but now has no possible way of making you sick and can just be used as a medicine. And so what I'm showing you here on this slide, this is an adeno-associated virus, or AAV. And this is quite literally the viral tool that changed everything. This is a virus that exists naturally in all of us. It causes no known diseases in humans. It also causes no diseases in any plants or animals, anything on Earth. It is the vanilla of viruses. And it's the tool that quite literally changed the game for us as viral gene therapists. And right now, today, we are living through what can quite literally be considered the fastest pace of gene therapy in history. From the moment we discovered it back in 1965 up until now, we've had roughly one breakthrough every decade, from when it was discovered to when we actually invented the concept in the field of gene therapy to when we first started injecting it into humans in clinical trials up until now. But you'll notice that the pace has started to get much, much faster. And in the last few years, instead of one breakthrough every decade, now we're having one almost every single year, right? These are FDA approvals for viruses. These are viruses that you can go to your doctor and get a prescription for a virus to treat these various disorders. And we are right at basically the exponential part of the curve where things are just going to start getting faster and faster. But talk is cheap and seeing is believing, and so I'm going to show you guys 3 sets of videos that walks you through 3 of these viral gene therapy success stories that I just mentioned on the last slide, and we're actually going to get to see these in action. So in each case, I'm going to show you 2 paired sets of videos. First, a little educational video that's going to walk you through how the viral gene therapy actually works in that particular disease setting. And then the second of those videos is going to be actual real human patients in a before and after, so you can see what happens with these viral gene therapies in action. And we're going to go through 3 examples. First, I'll walk you through a viral gene therapy that has cured a rare form of inherited blindness. Then we'll go through one that cures a rare form of a neuromuscular disorder that affects the skeletal muscles. And then lastly, we're going to go through a disorder that affects the nerve cells in the brain. So again, first we're going to start with a little educational video, and this one is going to walk you through how a viral gene therapy works in the eye for treating a rare form of congenital blindness. So we're going to begin our story here in the eye. And if we're talking about blindness, the tissue that we're going to be focusing on is in the retina, where we need to fix one faulty gene in the retina in the eye. So this is a tissue in the eye that's very important. It receives light from your environment, and it's going to send that signal to your brain so that your brain can now process that and create an image. And there's a protein in your retina that's very important in this process for you to be able to kind of manage those signals. And if that protein is not present, you won't be able to see, and that can lead to your blindness. And so the specific gene that's faulty in these patients is called RPE65, and it codes for that protein. And so we can take that gene, place it into a virus, and now we have a viral gene therapy that we can use to treat patients that have that RPE65 deficiency. We can take that virus, and the way we deliver it, we actually deliver it underneath the retina in the eye, so the virus is exactly where it needs to be in order to express that gene and express that protein, so that way you can get all of those light cues from the environment, send those signals to your brain, and restore your vision and correct your blindness. And so now we're going to walk through some patient videos from a clinical trial. And so what I'm going to show you here on this slide is 2 different videos. The one on the left is before treatment, and the one on the right is going to be after treatment. And what I'm going to show you before I start this video, this patient is going to be asked to navigate that little maze that's on the floor, that 8 by 8 foot maze. And it's got arrows that they're supposed to walk along, and then there's little obstacles for them to also attempt to clear. But remember, this is a patient that has a rare form of congenital blindness called Leber's congenital amaurosis, right? So they're medically blind at birth, so they can't actually see this maze that's on the floor that they're being asked to navigate. The second important thing is you'll notice that this looks very kind of yellow, and that's because this test is happening at 1 luminal unit, or very low light. All of us in the room have much poorer visual acuity at low light than we do at high light, and so we run these tests in very, very low light, so that's why it looks yellow. It's not that this video was taken in 1985, it's just that it's taken at very, very, very low light. So I'm gonna go ahead and start this video and talk over it. And so you can see this patient attempting to navigate this maze, but remember, they're medically blind, so they can't actually see this. So they're kind of putting their foot in front of them the way that you and I would do if we couldn't see and didn't have a walking stick. You just kind of feel for what's in front of you, so that way you don't accidentally trip and fall. I'm not actually going to show you this entire video because it took this patient 214 seconds to attempt to navigate this 8-foot by 8-foot maze. If we look at the next video here on the right, this is that exact same patient after receiving their viral gene therapy, and you can see they're perfectly able to navigate this maze, follow the arrows, move over the obstacles. They are completely cured of their blindness. And all they received was a single viral injection into their eye, one time. It'll last their entire life, and we have completely cured this patient of blindness. This patient has now gone on, they were 10 at the time they got treated. This patient has now since gone on to get their driver's license and is quite literally walking and driving amongst us. They're living a completely normal life. All right, so now we're gonna get to our second example. So now I'm gonna show you a viral gene therapy that cures a fatal neuromuscular disorder that happens in the motor neurons in patients that have a disease called spinal muscular atrophy. So again, this is a disease that happens in motor neurons along the spinal cord, and if you're a patient with SMA, you can eventually progress to not being able to walk or sit up or eat or even breathe, and this can obviously become fatal. And again, they have a defect in just one single gene that they need to have corrected, and this time it is a gene called SMN1 that codes for the SMN protein. And this protein is key because it tells your motor neurons basically how to work with skeletal muscles. And if you don't have that, you'll experience those symptoms. And your motor neurons will be very unhappy. So here again, we can use an AAV virus. We can package a functional copy of that SMN gene that you need that codes for the SMN protein. We can deliver this to patients in order to correct their symptoms. We need this to get into every one of their motor neurons so that it can express that protein throughout the body. So in this case, we're going to deliver it either intravenously or directly into their spinal cord so that it can get all along their body. But for these patients, time is really key. We want to get to them as early as possible so we can diagnose and treat them as soon as we can so that these patients can experience the best possible effect and the highest improvement in their quality of life. And so now, again, we're going to walk through two different videos. The one on the left is a young patient named Brett who currently is experiencing spinal muscular atrophy, and I'll let you kind of get a glimpse at his everyday life.
Brett has spinal muscular atrophy. Brett loves to watch movies. He is very into sports, also read books to him. He communicates through the Dynavox.
Paige, I love you.
Oh, I love you too, Brett.
And now this second video on the right is actually not of Brett, it's of a different young boy, right after he's basically received his viral gene therapy to treat his spinal muscular atrophy. But again, these boys are about the same time, or at least the same age. There we go. Right, so right away you can see this little guy is able to stand up on his own. That is not something a normal SMA patient would be able to do. He's able to play and move outside. He's meeting his normal developmental milestones that you would expect. It's been durable, 4.5 years after treatment. He's still doing fantastic. He's able to essentially lead a completely normal life. And now for our third example. So again, I'm going to show you a video, and this is going to talk you through how a viral gene therapy can be used to treat basically a nerve disorder that happens in the brain in kids with AADC deficiency. So let's walk through this. So normally, in a healthy brain, you're going to have all of the nerves in your brain, and these nerve cells are basically conducting these electrical signals. And the AADC that I mentioned before is an enzyme that lives at the ends of these nerves. And AADC produces neurotransmitters. This is things like dopamine and serotonin. You've probably heard of these before. And these are really important because they help basically carry and transmit those electrical waves from one nerve to another. But in patients who have AADC, they have a block at the ends of their nerves. So when they are born, they essentially don't have that AADC enzyme, and so they don't actually make enough or any of those important dopamine and serotonin neurotransmitters. And so without that, there's no way to basically carry or propagate that electrical signal from one nerve to another, and this can actually be life-threatening for these patients, and they can eventually die. So here again, we can take a virus, we can package a functional copy of that AADC enzyme that they need. We can deliver these to these patients directly into the brain so it can get to all the motor neurons that they need in their brain, so that way their nerve cells can now conduct those electrical signals as they're supposed to. So now I'm going to show you a single video of one patient before and after treatment, and this is of a little young superstar named Riley as we kind of walk through her treatment journey. So this is Riley before she received her gene therapy. So struggling to move, struggling to hold herself up, struggling to breathe. And after treatment, you can already see her able to perform what is actually a very complex task. So hand-eye motor control movement, going in and being able to get those little treats from the baggie. 2 years after treatment, continues to keep improving. She's able to walk and climb completely under her own power. Able to play in the backyard. Able to do normal everyday tasks that we would all take for granted, like just walk around the house and navigate things. Again, meeting her normal developmental milestones and just completely thriving. So how do we go from a concept about a viral gene therapy from someone like me all the way up to something that's FDA approved that you could go get a prescription for? What is the path to patients for these types of things? So for both viral gene therapies and every single drug any of you have ever received in your lives, it always basically follows what's shown here on this slide. So first we start on the far left, and this is where all of the basic research happens. This often happens at academic universities. And once you've identified something where you're like, gosh, this seems like it could maybe be a drug, then you enter kind of what we in industry would call the drug discovery phase. And this is where you take all of the potential drugs that might perform that task that you're interested in for treating that disease, and you optimize them and optimize them and optimize them until you find something where you think that just this one drug might be ready to actually start testing in animals. In animal models of that particular disease you're trying to go after. And then you begin the next phase that we would call the preclinical phase, where you take that one drug and now you're going to start testing it in animal models of that disease. And once you think you've reasonably demonstrated safety and efficacy, then at this first kind of black circle, this is when you go to the FDA. And you ask the FDA for permission to run a human clinical trial. You show them all of the data from these two purple phases where you've demonstrated safety and efficacy in your animal models, and you have reason to believe that it's going to be safe and efficacious in humans, and you ask for permission to run a human clinical trial. And if they give you the thumbs up and the green light, then you can advance into the clinical trial phase, and now you can start progressing through those clinical trials from phase 1 and 2 and 3. In the beginning, the goals of a phase 1 trial are actually just to demonstrate safety. We want to prove that this drug is safe in human patients. And then you progress into phase 2, and this is where you're trying to find the most optimal dose of that drug where it is going to work best. And the phase 3 trial is when you now take your drug that you've demonstrated is safe, that you've got this Goldilocks perfect dose, and you're going to do this like head-to-head comparative showdown with the current standard of care drug and see actually who is better at treating that disease. And if the data looks promising at the end of that phase 3 trial, you again, at this next black box, go to the FDA and you show them all of the data from all of your purple phases here, and you ask them to review all of the data for your drug and determine whether or not they agree in the review process that this drug is ready to be FDA approved in order to be given to patients. And if they approve it, then that is the moment that you as a company can start selling and marketing your drug. And that's the moment that you as a patient can actually go and get a prescription for that drug from your doctor. Right, so now I've kind of walked you through these 3 example videos in the rare disease space, but you might be wondering what other diseases we might be producing gene therapies for and how many are there? The answer is there's a lot, and they're all they're coming for you. So don't be worried about figuring out necessarily all the details on this slide. It is meant to be overwhelming. That is the whole point. What this is a snapshot from a prospectus study that gets put out by Wells Fargo every year for each different industry. And here we're looking at the gene therapy industry. And the way you can look at this bullseye image is that there's different themed areas, right? So here, ophthalmology, this is eye disorders. So these are all the companies in this quadrant over here that are working on gene therapies for a different eye disorder. And just below that, right here in this quadrant, this is all the gene therapy companies going after brain disorders, and on around the image. And from the outside of the bullseye in, we're basically progressing through the science. So on these outer rings here, this is basically all of the companies who are working on gene therapies in those early phases, things like phase 1 and phase 2, where we're trying to demonstrate the safety and the efficacy of these in human patients. And then as we progress towards the center of the bullseye, we get to things that are in those later stages. And we get to the kind of middle ring here. This is filed. This is where folks have actually asked the FDA for approval for the drug, but they're waiting to get the thumbs up. And the things in the absolute center are the things that have been FDA approved and that are marketed and available for you to go get a prescription for. So the kind of takeaway from this slide that I want you to get a sense of is the fact that there's kind of a tidal wave of gene therapies coming. And so I can promise you that in your lifetime, regardless of how old you are, I don't see anybody that looks like they're like 99, regardless of how old you are here, you are gonna receive a viral gene therapy in your lifetime. So far, we've mostly been talking about very rare disorders. And you might be wondering what other types of diseases we can use these viral gene therapies and AAV for in order to transform human health. And so this is the exciting part of the story for me, because this is where my company, Siren Biotechnology, comes in. We took on the rather audacious task of wanting to bring, for the first time ever, AAV gene therapies to the clinic, but now for cancer for the first time. This is a disease near and dear to my heart. So someone is diagnosed with cancer in the world every 1.7 seconds. If that feels really fast, it's because it is. In the time it takes me to give this talk today, another 2,000 people are going to be diagnosed with cancer. This is unacceptable, and we need new therapies. One of the newest classes of therapy, therapy modalities in cancer, is this class called immunotherapy. You may have even heard this word before. And there are a variety of different ways you can accomplish this that I've shown here at the top, but in essence, they all kind of work in exactly the same way, where they retrain your immune system to fight cancer. And I'm using that word here, retrain, very purposefully. Right? Every single one of you in this room and watching along has a tumor. You have had a tumor, for the most part, every single day of your life. But why don't you have cancer? So, you have an individual tumor cell. They're often scattered throughout your entire body. And what ends up happening is that the healthy cells that surround that individual tumor cell can basically sense that something is wrong with that individual cell. And they can send off these chemical cues to your immune system, letting your immune system know that, I don't trust this guy. Something's up, something's weird with him. I want you to come and run an investigation. And your immune system will receive those cues, and it will come along, it will run the investigation. And if it agrees that something is wrong, it will kill that cell while it's still an individual tumor cell and before it had a chance to become a large tumor. Right? So your immune system, you are very good at fighting cancer. You have done it every single day of your life. You're doing it right now while you're sitting here. Right? So how does anyone ever actually get a baseball-sized tumor? How does that happen? If I've just told you your body is exquisite at being able to fight cancer. What can happen is that individual tumor cell, through a variety of different mechanisms we don't have time to get into, but through a variety of different mechanisms, that tumor cell can evolve a random mutation, and that random mutation, through a variety of different means, can essentially give that tumor cell an invisibility cloak. And if it's invisible, then the healthy cells that surround it can't sense that something's wrong. If they can't detect it and sense that something's wrong, they're not going to send those chemical cues to your immune system. So your immune system's not going to come run an investigation, and your immune system also isn't going to randomly swim by and be able to see it and sense that something's wrong and kill it before it has a chance to grow. And so since it's invisible, it can't be detected, and so now it has the time that it needs so it can start to grow and replicate and become that baseball-sized tumor. You get symptomatic, you go to the doctor, right? You're going to get diagnosed. Right? But normal chemo and radiation does not have the ability to retrain your immune system in order to fight these cancer cells. So how does immunotherapy do this, and how does Siren do this? So Siren had actually developed a brand new class of immunotherapy cancer therapies, where we're actually blending, for the first time ever, these AAV gene therapies, these precision delivery viral tools, with those chemical cues, cytokines that we were just talking about in the last slide. We can actually blend these together into a single drug that we're calling AAV immunogene therapies. And this modality is completely safe, it's antigen independent, it's tumor specific, it's durable, and it could potentially treat any cancer. So it's not specific to any one cancer, it could potentially treat any of them. And we needed to decide kind of where to point the ship first, and we decided that we wanted to go after brain cancers broadly. Brain cancers are an area where there's literally no effective drugs. Many of you probably already knew this, right? The two cancers you don't want are brain cancers and pancreatic cancers, right? So we wanted to go after brain cancers first because there's so few effective drugs and the unmet need is so large. One of the stats that just always breaks my heart is the one here at the bottom. The average survival of patients with the most common form of malignant brain cancer in humans is only 1 year. And we just felt that this was unacceptable and that we needed to do something about this. So now I want you to actually hear from the Siren team themselves about a little bit about what we're doing.
Cancer diagnosis is a community nobody wants to be a part of, and the moment you are, it changes your life forever.
One of the biggest challenges for cancer research is that there is not a universal solution. There are still patients who have no cure.
We wanted to kind of attack that head on and see if we could answer a really crazy question, which was, could you make a universal gene therapy?
A universal gene therapy refers to the notion that the drug and its payload works for multiple different types of cancer.
In our field, we're used to thinking about it in a one-for-one setting. You make one virus and it can be used to treat one disease.
In our case, we're using that virus to deliver the information to produce large amounts of a particular cytokine within a tumor. We can introduce a cytokine that tells the cancer cells to stop growing. It can be a signaling piece of information that tells your healthy immune cells something's up. It's revolutionary to use a virus to overcome the issues of toxicity that were associated with the original protein therapeutics. If we can bring a solution, this has the potential for what would be universal level change.
All right, so now that you've seen a little bit of the what of what we're doing, now we need to get into the how. How do we actually do this? How do you take a drug, any drug, much less a viral gene therapy, how do you take a drug that is meant to treat human brain cancers before you are allowed to put it in humans? And the answer to that is you actually make mice with a mini human brain tumor. So how in the world do you do that? So first, you take a tumor out of a human brain tumor patient. This is a tumor that was going to be resected as part of their normal therapy. This is a tumor that was going to be thrown away. And then you can take that tumor and isolate those tumor cells, and you can actually genetically modify them to glow in the same way that bioluminescent algae that you've seen in the ocean when you're on vacation, the same way that those cells glow. So we can take these now glowing human brain tumor cells and we can transplant these into the brains of healthy living mice and create mini human brain tumors in the brains of these, again, living mice. We can image these mice with a special imager that I'll show you on the next slide and confirm that the tumors are there and that they're growing and glowing. And then once you've confirmed that the tumor is ready, you can come in and now test your drug. So in our case, we can treat it with our viral gene therapy and look to see whether or not the tumors are growing or shrinking in real time because we can image these brains. So I'll show you here this on the next slide. So again, we want to be able to image whether or not this is being successful in real time. So I'm going to show you a video here on the left that's a little schematic of how we actually image these mice to look to see whether or not the tumors and the therapy are working in real time. So we can take our special humanized mice that have a human brain tumor, we can place them on a warming platform, and then we can irradiate them with this basically blue wavelength of light. And this blue wavelength of light will get absorbed by those glowing human brain tumor cells, and they will reflect back that red wavelength of light depending on how big the tumor is. So it's a very proportional, basically, measurement. So if you have a very small tumor, you're going to reflect very little of that red light. If you have a very large tumor, you're going to reflect a lot of that red light. So we can actually measure and quantify at the top up here in the detector the amount of that red light that's there, and that will tell us whether or not the human brain tumor in that mouse is growing or shrinking. And you can actually see examples of this here on the right. So this is just a little schema, right? Put the glowing tumor cells into the mouse brain, and you can see these human brain tumors in these mice here on the right. And these mice are alive, right? They're just anesthetized. You can see their nose is on a little nose cone, so they're just receiving some happy gas while they're getting this imaging. And we can watch in real time, confirm that the tumors are there, treat them, and then look to see whether or not the tumor is growing or shrinking in response to the therapy without ever harming the mice. And so what does this actually look like when we actually treat these animals? So again, we can take animals, I'm just showing you 8 here for simplicity. We can treat them with like a control drug. This could be sterile saline, this could be an irrelevant virus, this could be the standard of control brain cancer drug. In all cases, the control animals will always end up succumbing to their human brain cancer because it continues to grow, versus the mice that receive our therapy where we can completely eliminate these tumors. But this can sometimes be a little bit hard to grasp, so we've actually made a little schematic to kind of help ground what we're talking about here. So if we represent all the mice we've ever treated, these humanized mice, well over 600 of them at this point, if we represent all these mice here, the control animals, as well as the ones that have received our universal AAV immunogene therapy called Siren 101, and we start the experiment clock, you can see that within 3 weeks, how many of the control animals have died versus the animals that received our viral gene therapy drug, within 8 weeks, and within 12 weeks. And at 12 weeks, you can see that in no case have we ever had a control animal survive their brain tumor versus the animals that have received Siren 101, where 86% of all the animals we have ever treated continue to be alive and thriving. They have been cured of their brain cancer. And so now we're actually progressing and getting even closer to the clinic. And so now we've begun testing the infusion method that we're going to use in human patients in pigs. And so what you can do is actually take that virus, infuse it into the brains of pigs. Pigs actually have a very similar brain anatomy to humans, so they make a very good model for this. And we can use the same rig that will be used to infuse the virus in humans. And we can watch this again in real time using MRI, so we can watch the virus being infused. And that's actually what you're seeing here on the bottom. This is an alive pig that is in an MRI machine. This is its head. You can see its brain here. Looks very much like a human brain. And in this MRI, you can see that white spot there. That is our virus that we just infused into these pigs. It's staying precisely where we want it to. It's not leaking and going everywhere out throughout the body. And so we can watch in real time and ensure that the method that we want to use in humans works in pigs. And this is actually a requirement that the FDA has. So before you can start human clinical trials, not only do you have to test your drug in a small mammal, like mice or rats, they also want you to test it in a large mammal. So things like pigs, primates, et cetera. And so we're doing these studies in pigs. So where are we at, Siren, in this path to patients that I just showed you before? We are right here in the middle. We have just basically finished the ends of the animal studies that I just showed you a little hint of. There's far more than what I've shown you, and we're about to be able to start our human clinical trials here in the next year. But the brain is truly just the beginning, not just for Siren, but for the entire field of viral gene therapy. And now that I've kind of given you a taste of what these viral gene therapy technologies can do, you might be asking, what other ways could we use them to enhance human capabilities? So for example, there's an estimated 43 million people in just the United States that have very low bone mass, right? These are people who are at extreme risk of things like osteoporosis. We could treat these patients before they ever end up having low bone mass, before they ever get osteoporosis. We could prevent this with gene therapy. Another example, we could improve oxygen transport. 1 of every 4 people on the planet is anemic. Right? Anemia is when your blood doesn't have enough healthy red blood cells and hemoglobin to be able to carry oxygen throughout your body. This could be quite dangerous. Right? We could treat these people, particularly patients and folks who live at high altitudes, or even athletes. This is one that I think we probably all care about, muscle loss. Every single one of us loses about 2 to 5% of your muscle strength every single year after you turn 50, and this puts you at all kinds of risks. We could treat people before they ever end up experiencing this muscle loss so that you could maintain your strength as you age. But that was all within the realms of normal health declines and normal medicine. What else could we do to potentially use these viruses to expand human potential? Right? There's a lot of activity happening right now in deep tech, in space, and the types of medicine that are going to be needed in space are almost an untapped market that we have not started thinking about and preparing for yet. Aging, the possibilities to really kind of turn back the clock and give all of us a more healthful and youthful and stronger, right? We were just talking about bone loss, stronger version of ourselves so that we could use longevity to our advantage is something right at our fingertips. We could start working on aging and longevity. You could imagine a scenario just 25 years in the future, waking up in 2050, and we'll be engineering viral gene therapies to do all kinds of interesting things within the viral gene editing space. You could imagine a child that has a genetic disease getting treated in utero before they ever even develop the symptoms of their disorder. You could imagine a cancer patient that receives, hopefully Sirens, a single injection of a virus to program their immune system to fight off their tumor and prevent it from ever recurring, making cancer a thing of the past. We could get creative, right? We could treat our Mars-bound astronauts with gene therapy to undergo genetic modification in their genes to help them to be able to better handle the radiation exposure that they're going to experience on the Martian surface. All of these are possible. And I would feel remiss if I didn't mention this in kind of the current moment that the US is home to gene therapy innovation. We are the envy of the world. We have the most gene therapy innovations that are published. We develop the most patents for the most innovations. We have the most gene therapy companies that employ the most workers with high-quality gene therapy jobs. We host the most clinical trials and treat the most patients and create the most hope. We are the envy of the world, and I hope we don't forget that in this moment. Today's story has really been about the power of redemption and that what has happened in the past does not always necessarily have to reflect your future, and there are so many good things that are possible. And particularly as we think about this moment that we're in, I hope folks will take the time to reflect about what scientific stories, societal stories, or even personal stories are kind of due for a redemption. And will we all collectively be brave enough to rewrite the narrative together, because we're going to need to rewrite it together. There's so much to be excited about in science and in medicine right now. There's just so much stuff coming. So this viral redemption story has been billions of years in the making, and we're just getting started. If you're as excited about the future as we are, I invite you to join the movement. Thanks so much.